Disc bulge injuries, they cause a lot of pain and suffering. Now, whether it's an L4, L5 disc bulge or maybe an L5S1 disc bulge, all the patients I have personally seen in my office with disc bulge injuries, they want 4 outcomes from their care and treatment. Number 1, definitely get out of their current pain condition, their pain circumstance. No one wants that excruciating pain associated with a disc bulge, whether it's back pain or leg pain. Number 2, to avoid surgery. Most of my patients that have disc bulge injuries, one of their goals is to avoid surgery. If anything, leave it as a last resort option. Number 3, of course, get back to a normal level of function, normal level of regular activities in life. Just get your life back to normal. That's what people are looking for. And number 4 is to prevent that recurring disc pain or symptoms associated with disc injuries or disc bulges. Prevent it from reoccurring again into the future. But unless the lower back area is strengthened properly with good strengthening exercises, the likelihood of re-injuring the lower back and possibly even a disc or disc bulge is very high. This is why it's really important to get that lower back area strengthened and stabilized when there are disc bulge injuries. Hi there, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. At my office, we've helped hundreds of patients with chronic spinal conditions like disc bulges, sciatica, leg pain, neck pain, arm pain, numbness, and tingling. And in this video, I will show you 3 key exercises for bulging discs.
And remember to subscribe to my channel and hit that notification bell.
Not only will I show you these 3 exercises for bulging discs, strengthening the lower back, I'll also show you step-by-step instructions on how to do them, how many sets are required, reps, and when to do them throughout the day. These are the exact exercises that I've given to many of my patients, and one in particular who had low back pain and leg pain related to L4, L5, and L5S1 disc bulge. She started to do these exercises that I'm about to show you in this video after she completed her corrective care program for her spine and posture. She told me that her back felt stronger, felt more secure, and she was able to prevent that reoccurring pain that she suffered for many years because of these exercises. Keeping the back strong is essential for preventing recurring back injuries, recurring back pain. And these exercises I'm about to show you are designed for that. Now, keep in mind that these are intermediate to advanced level exercises for the lower back, which means in most cases, if someone has an acute back pain or leg pain or is in an urgent pain situation, they may not adapt well or be able to perform these exercises. And I always want to say that it's best to get clearance from your primary health practitioner, the person, the doctor that knows your condition and your clinical picture better than anyone, to get clearance before you do any exercises whatsoever. Now, here are the 3 key exercises for bulging discs.
So here's exercise number 1. Superman. Superman is a really great exercise to strengthen the lower back muscles. If you follow the cursor right here, really helps strengthen the lower back muscles and also get some glute activation and hamstring activation as well. But really contracting the stabilizer muscles of the lower back over here. And when you start this exercise, you'll be lying flat on the floor, flat on your stomach. Palms are going to be flat on the ground, and the next step you're going to do is you're going to follow the picture. You're going to raise your chest and arms off the ground as you raise your legs off the ground and thighs off the ground. Try to clear the thighs from the ground. If you have trouble lifting the thighs off the ground as you're extending back like this and you can only lift the legs, that's fine, but eventually work on extending your thighs as well so they're off the ground. So you see you're in a position that's called Superman. If you can imagine the superhero Superman flying through the sky with his arms up in the air in an extension position. And this really helps to activate the entire erector spinae muscles, which are your lower and mid back paraspinal muscles, especially in the lower lumbar region over here. Very important area. You're also getting some glute activation, gluteus maximus activation, which is an extensor of the thigh, and some hamstring activation here as well. But essentially, it's a really great activation exercise for strengthening and activating the lower lumbar spine, the muscles which are usually weak when there's disc bulge injuries. So what are the dosages and how do you do this in terms of instructions? So let's go over the reps, the sets, and the time. So start with one set of 10 repetitions. One set of 10 repetitions, and you hold that for 1 second. So you'll start off like this, and you go into the Superman position, hold that for 1 second. That's one repetition, and you're gonna do 10 of those in one set. So 10 repetitions in one set. So each time you come up from here to here, hold 1 second. Then you come down, and then you go up, hold 1 second. Then you come down, and then you go up again, hold 1 second. You kind of get the idea. You do that 10 times. Then you work up to 3 sets. So you're going to do that 3 sets of 10 reps each, which is a total of 30 repetitions. You're not going to jump from 1 set to 3. You go from 1 set of 10 reps to 2 sets of 10 reps to 3 sets of 10 reps. If you can't do 2 sets of 10 reps, which is 20, then you do 15, and eventually 20, and then 25, and 30. So you work up to 30 repetitions or 3 sets of 10, each holding for 1 second. In between sets, you take a break. You can take a 20, 30-second break for recovery, even 1 minute break for recovery. This is great to do at least once a day. Twice is good, but at least once a day, and can be done in the morning or in the evening. And you can also work this into your other exercises, whether it's stretching or mobility exercises that you do right now for your overall general health or for your back. Great, let's move along. This is exercise number 2, prone plank. I really like the prone plank. I give this to a lot of my patients. It's a great core strengthening exercise. And you're going to start again in the prone position. So you're lying on your stomach flat with your hands on the ground over here, just like that. And you're going to lift yourself up. Your entire body will be lifted up off the ground, and you're going to rest on your elbows, which looks like this. Okay, so you're going to start here and lift yourself up. And you'll be on your toes. Your legs and knees are completely activated. Your glutes are activated. Your paraspinal, erectospinal muscles are activated. And you're in what's called a plank position, a board. No dipping down, no sagging down, and no teeping up. That would be cheating, and that would not be a complete core activation. It's called a prone plank because you're not up on your hands. There's a full plank where you're completely up here, and then you're on your hands as well, but this is a prone plank. It's a great intermediate core stabilizing, core strengthening exercise. So reps, sets, and time. So with this one here, it's different. You're not going to do repetitions. You're going to hold it for your maximum amount of time. Now that's going to be specific for you. So you want to hold to your maximum. So you want to hold this position to your maximum amount of time. Your goal should be to hold your initial goal. If you're having trouble with this, or if you're still beginning with this, try to get to at least 30 seconds. You want to work up to essentially 2 minutes. Okay, that's your ultimate goal. You should be able to hold a prone plank for at least 2 minutes. But you start with 30 seconds, that's your first benchmark goal. Work up to 60 seconds, work up to 90 seconds, and then eventually 2 minutes. That would be your target goal. So you're progressing towards that time. Again, you can do this once a day, either morning or evening. And once you do your 2 minute hold, or whatever your hold time is for you, you can take a little break, and then you can do it again if you wanted to. So you can do this exercise in the morning or in the evening, and as the previous Superman exercise added to your other exercise regime, your stretching, mobility, your other low back exercise program that you're doing. Great, let's go to key exercise number 3, side plank. Now side plank, this is how we start. Side plank is a bit more of a advanced core strengthening and stabilizing exercise. So the starting position, you're going to be on your legs and knees on your side. Of course, you'd be lying down flat on your side first. You're going to prop yourself up on your elbow just like this. You want to lift your hip over here, your glute buttock area, up this direction, upwards off the ground, like that. And you can see you're in a board-like plank position, completely neutral, okay, from torso down to your pelvis, down to your knees and ankles. And you're getting a lot of activation of your lumbar spine muscles, paraspinal muscles, multifidus muscle. Super great activation exercise for the lower back. Now, this is an advanced exercise. You might not start with this. You may start with the Superman and then work to the prone plank and then eventually the side plank. And you also want to do both sides. So if it's left side down now, after you're done the program with the exercise, then you do the right side down. So let's go over the dosage. First of all, let me show you again how you start. So you're starting flat on your side, prop yourself up on your elbow, and then you lift your pelvis off the ground, so you're creating a space here. Again, watch you don't dip down and don't TP up to try to get higher to activate more muscles. You need to hold yourself in this kind of straight plank neutral position. Reps, sets, and time. This one here, just like the prone plank, you want to hold to your maximum time. Hold your maximum time. And again, your goal should be to get to 2 minutes. Okay, 2 full minutes of that hold position, which is very challenging. But start with your initial goal benchmark of 30 seconds, work up to 60 seconds, then 90 seconds, and eventually 2 minutes. And you should be able to do that on each side. So you have to repeat on each side. Work it into your other exercises that you're doing already, and it can be done either in the morning or in the evening. And again, you can do, once you get your max hold, you want to take a break, you can repeat it again 2, 3, or 4 times if you wanted to.
There you go. Hope you enjoyed seeing the instructions of those 3 key exercises for bulging discs. Very, very important for strengthening and stabilizing the lower back, the lower spine, especially for when there's injuries related to disc bulges, and especially for preventing the reoccurrence of disc injuries and back pain and leg pain. Very, very important. And now I want to hear from you. Which of those 3 exercises do you find will be most useful for you? Would it be the Superman exercise, or would it be the side plank? Comment below. I want to hear from you. Of course, if you ever have any questions about chronic spinal conditions or disc bulges, you can also leave in the comments below. I do my best to answer to all questions. And if you're new to this channel, I want to welcome you. Be sure to click on that subscribe button and click on that notification bell so you don't miss out on these regular video tips that I put out on a weekly basis. And don't forget to share this video with your family and friends, add it to your playlists. This is Dr. Walter Salubro, and I'll see you on the next video. To learn more about how Corrective Chiropractic Care at Back to Health Chiropractic Center can help you with your chronic pain problem, visit www.ibthcc.com. Back to Health Chiropractic Center is located at 20 Cranston Park Avenue, number 6, Vaughan, Ontario, L6A2W2.